Hi guys, welcome to my channel Knowledge Liberates. A lot of my subscribers are from South India or from parts where they do not understand Hindi. So I thought that two of the most important videos for OCD patients is ERP therapy and ACT therapy. Okay, exposure response prevention and acceptance and commitment therapy. So I thought that I will make acceptance and commitment therapy video in English so that people who do not understand Hindi will be able to watch this video and will be able to do ACT therapy. So ACT therapy, acceptance and commitment therapy, is about accepting your thoughts and emotions, accepting your unhelpful thoughts and emotions, and then committing to your goal. So as the name goes, acceptance and commitment therapy, you accept things which are not in your control and then commit to things which you can control. So basically the main agenda or main crux of ACT therapy is that you the things which are not under your control, you accept them, and the things which you can control, you change them. Okay, so for example, if you do not like how you look, or for example if you do not like you do not like your parents, for example. So parents, can you change them? No. But how you look, can you change them? Maybe you can change how your hairstyle, or maybe you can change your diet, and you can become fitter. So things you can change, you should focus on them, and things you cannot change. For example, if I keep on thinking that okay, I should have 6 fingers, I'll not be happy till I have 6 fingers or 7 fingers, then I will never be happy. So things which you cannot change. Or some people just keep on thinking that I should have born rich, I should have been born to richer parents. Can you change your parents? Can you change where you were born? No, that is not in your hands. Or for example, in some OCDs, people keep on thinking that why am I born, and what is the purpose of life, and this life I have nothing to do, or whatever. So things which are not in our control. For example, past. You keep on thinking about past. You keep on thinking about real life events that happened, and that also becomes an OCD. So things which are not under your control, you should let them go, you should accept them. Okay, and things which you can control, you should focus on them. For example, you cannot change the result, or you cannot, for example, you are studying for an exam and you keep on thinking that will I pass or will I fail, will I pass or will I fail. Do you think that you have control over that? I don't think so. How much ever you think that I'll pass, how much ever I think that I get 1 crore rupee in my hand, will it come? Thinking does not create any result, right? So why do you keep on focusing on result? Why do you keep on thinking about things and do not act about things? Act, I mean like action. Okay, so there are 6 pillars of ACT therapy, acceptance and commitment therapy. 6 pillars. First is cognitive diffusion. In cognitive diffusion, diffusion means to separate two things. Fusion means to fuse, to combine two things. For example, this is about thoughts, that you should not fuse with your thoughts. For example, if you think, some people think that, keep on thinking I am a loser, and then they believe it. Yeah, I am a loser. Right. But the thing is that if I think of negative things, then people accept it very soon. That if I think of negative things like I am a loser or I am a failure, then people accept it, then people start believing it. Okay, I am a failure. But why do you not think that I am a hero, I am Shah Rukh Khan, and then believe that? Very few people do that. Very few people think and believe positive things about themselves, but they keep on thinking negative things about themselves, right? So you need to focus on the thing that thoughts, right? Thoughts are not real. All the thoughts that come to your mind are not true, and you are not your thoughts. You are not if I keep on thinking I am a rabbit, will I become a rabbit? Thoughts are not your identity. Thoughts are not always true. Our mind gives automatic thoughts. For example, if I keep on sitting here, I will keep on getting thoughts. even if I don't think, like the mind's duty is to give me thoughts, right? So you cannot, people ask me, sir, can I stop my thoughts? You will only stop your thoughts when you are dead. Your mind will keep on working. That is the duty of the mind. That is the work of the mind. You cannot stop. The mind has become like this after so many years of evolution. And for example, earlier it was a PC, like a desktop, and now it has become like a MacBook with evolution. And now you are saying, no, I want a desktop back. I want a mind which does not think so much. No, the mind will keep on thinking. It is a tool. How do you use it? It depends on that. So don't go to a lot of thoughts which are unhelpful, negative. You don't have to engage with all those thoughts. All those thoughts that come, you can let go also of those thoughts. For example, if I keep on thinking that I am a loser, I am a loser, I will not become a loser. I can, if I am studying, I can just ignore those thoughts and just focus again on what I am doing right now. For example, when I am making this video, then also sometimes my thoughts come, intrusive thoughts come. What are intrusive thoughts? Thoughts which you do not want, but they keep on coming to you, and they keep on like repeating, right? So those intrusive thoughts, you give importance to them. You feel that they are your identity. For example, people who have homosexual OCD, they get the thought that they are gay, and they believe it. Okay, this thought has come, so I am gay. But that is not the thing. These thoughts are not your identity. You keep on thinking anything. You keep on thinking, I'll become the son of Ambani. Will you become the son of Ambani? No, right? So why do you believe your negative thoughts? So next time a thought comes and that you do not want it, just be aware that this thought has come, and just say, this is a thought, and again come back to your studying or whatever you are doing. So this will create a distance between you and your thought. So when you say this is just a thought, or oh okay, thought, so it will create a distance between you and your thought. You don't have to do for every thought. For example, in the start, whenever your awareness or your focus shifts and it goes to the thought, to the intrusive thought, then you say this is a thought. You don't have to do it for every thought. You only have to do it for a thought which is which has if you are doing something and which has made you dysfunctional, or which has put away your focus somewhere else. It has taken your focus, and it is also creating anxiety. So intrusive thought in OCD always comes with anxiety. So a thought which has brought anxiety and which is taking away your focus, you need to say, okay, this is just a thought, and bring your focus back to what you are doing or what you are studying, right? So create distance between yourself and your thought. You are not your thoughts. So just say this is a thought, and you can do this. For example, people feel that you have to believe your thought, or every thought is every thought is true. You need to, if you think it, then you become it. But it is not like that. I know a lot of law of attraction and all has made you think that what you think you will become, but it is not like that. If I keep on thinking that I am a mouse for 1 year, do you think I'll become a mouse? Maybe mentally I'll become a mouse, but physically I will not become a mouse. So I cannot become this, whatever I think. And mentally I become a mouse, that is like a mental that is not something powerful. That is a mental like illness for me, that I my mental ability becomes like a mouse, right? So that is not what I would want. But I'll give you an example. So for this is a mouse, and if I keep on thinking that I will drop this mouse, I will throw this mouse, I will throw this mouse, I keep on thinking, but have I thrown this mouse? No, right? I have not. I'm still holding it. So these cognitive diffusion tells you that these thoughts can keep on coming in your mind, but you will still not do what that thought is saying, because you have that control to choose which thought to work on, which thought to act on, and which thought to let go. That is your choice. When I say act here, I means action. Like you want to do something about it. For example, a thought comes, you are very angry, and a thought comes that I will punch that person's face. But it depends on you that if you want to punch him or not. That is your choice. So that choice only comes with awareness. And the second pillar is self-awareness. Okay, like mindfulness. being present in the moment, right? Being present in the moment. And second is also self as context. These two things these two pillars I will explain together. So being in the present moment and self as context means that you have to you have to be aware what is happening in your mind. If you are aware, if you train your focus, then you will have the ability to choose your thoughts and emotions. For example, most of the people, if they get anger, they feel anger and they will become angry. But feeling anger and becoming angry is a different thing. For example, sometimes it could be that you are in a fight, or you are in an argument and you're feeling very angry and you want to shout, but you will not shout because you are aware that okay, anger is coming to my body, to my mind, but I will not become angry. So you are present in the moment. And self as context is means the self is one is self as content and one is self as context. In self as content, it shows that you are your content, means you are your thought, but self as context says that no, you are not your thought, you are your awareness. It has a spiritual meaning. So in spirituality, in Indian yoga also, we say that people say that who am I am awareness. Where people say soul can be considered as Atman, like awareness. You are pure awareness. You are focus. I always say that awareness is your superpower. So please cherish it and do not let OCD take your awareness. OCD has taken your awareness. These thoughts, these feelings are thieves of your awareness. So don't let these thoughts, these intrusive thoughts and feelings affect your awareness, right? So you need to train your awareness. To train your awareness, meditation is best. Breathing meditation, mindfulness techniques like mindfully walking, mindfully gardening, whatever you are doing. Tell me how many like in a day, or how many times are you really mindful of what you are doing. For example, most of the people who drive, they drive but they are thinking about something like what will they cook when they come back home, or what is their wife doing, and what is their mother doing. So thoughts keep on coming to their mind. That is a default setting of our mind. Whenever we sit alone, it says people say that, right, that an empty mind is a devil's workshop, because the default mode of the mind is that if you sit idle, you don't do anything, the mind will keep on giving you thoughts. But you need to train your focus. That is why people also say that OCD patients should always be busy. And I will say that in the initial stage of when you are initially trying to get rid of OCD, you are in the recovery mode, then you should keep yourself busy. Getting a hobby is very important. So you need to be mindful, aware that these thoughts are coming. Create a distance by saying this is a thought, and come back to what you are doing. Maybe you are doing, reading something, working something, and if you are not doing anything, maybe you are watching a movie, just get your focus back to the movie, right? And then if you're not doing anything, then maybe you can bring your focus back to your breath. Sometimes people are confused that even how to train your awareness. So I will say that start from meditation. I have made videos on meditation. So basically you close your eyes and you feel just the breath in your stomach. Your stomach is going up and down when you exhale and inhale. So you focus on that movement and you just keep on focusing on that. Keep on concentrating on it. And if a thought or a feeling takes away your focus, if you start thinking about something, then bring your focus back to breath. So this is how you train your mind. It is like it goes away, then it comes back, it goes away. It is like training a muscle, training a bicep. You keep on doing it and it becomes stronger. Your focus becomes stronger. Okay, then fourth is acceptance. Acceptance, it says that anxiety, or like every emotion is, no emotion is positive or negative. It is about how you see it. For example, in some societies, smiling is not considered very polite. people like in Eastern European countries, they don't smile much, but in India smiling is considered good, right? So emotion, every emotion may be good or bad somewhere, so you just give meaning to it. No emotion is good or bad, but unfortunately you have thought that anxiety is bad for me and you resist anxiety, and it says that what you resist persists, means what you resist will become more. So if you resist your anxiety, it will become more. But if you accept your anxiety, what does accepting your anxiety means? Anxiety is what? Anxiety is just body sensations that come to your mind, come to your body. For example, when you feel anxious, when I feel anxious, I feel tightness in the chest, I feel dryness in the throat, I feel tingling sensation here, I feel sweat. So what the thing is, technically I am not afraid of that anxiety. I am afraid of those body sensations. So if and the thing is that when you feel anxious, a lot of anxious thoughts keep on coming to your mind. For example, if you have harm OCD, then thoughts that you may harm someone, you are a harmful person, those thoughts keep on racing thoughts. A lot of thoughts, fast thoughts come to your mind. So the thing is that you have to shift your focus from those thoughts to those body sensations, to your body. Like you shift your focus to breath in the meditation. In the same way, you need to shift your focus to body sensations. You shift your focus to, okay, my throat is drying up, I am getting sweat, I am feeling cold, tingling sensations. If you focus on your sensations, close your eyes and just focus on your sensations, you will see that these sensations will die down with time. What you have thought of is of a mountain is just a mouse. Okay, so if you feel it, if you run away from it, for example, you are in a dark place and a rope is thrown on you, you may feel that it is a snake. But when the light is on, you know, okay, this is not a snake, this is just a rope. That is what is happening with you with anxiety. Anxiety is just anxiety, it is just body sensations. But you have thought like, no, it is not body sensations, it is something else. Okay, so you need to you need to see that clearly. If you see it clearly, in India, philosophy is called darshan. Darshan means to see. When you see a thing clearly, it becomes clear. So you need to see your anxiety clearly, and you will see that it is just a mouse, it is not a mountain. So best way to accept your anxiety is to shift your focus from those anxious thoughts when the anxiety comes, and shift your focus to body sensations, and it will go. And if the anxiety is too much, then you should shift your focus to your body sensations. But if the anxiety is not that much, so then you shift your focus from your anxious thoughts to your work again. But if the anxiety is too much and you are not able to work, then you need to focus on your body sensations. Okay. And the fifth and sixth pillar is, you need to know what is your values. Values are things that you have significance in life. For example, some people have like they want family, they want to be honest, they want to, for example, be famous, or they want to have a lot of money. It could be any value. They want comfort. Value is a thing which is never ending. For example, people want to be honest, people want kindness, people want to be confident, people want to be strong. So this is a, like, people want to be healthy. This is a lifelong struggle, right? So the values are things that you can struggle for lifelong, and you need to stick to your values. So ACT therapy says that whatever negative emotions or thoughts come, right, you need to accept those thoughts. You need because of those thoughts, you should not give up on your values, you should commit to your values. However, see, the thing is that mental illness is not like fever, that you take a medicine and the disease will be over. No, you have to in mental illness, you need to understand the issue, you need to tackle it, you need to take it head on, you need to fight it. Okay, so you need to understand it. So you have to commit to it. For example, today you may not do any compulsion, but the thing is, the second day you may do compulsion. You don't have to give up. You don't have to feel sad that I have done compulsion. You try it again on the third day. So keep on doing that, keep on trying. That is how you will become stronger, right? So these these things, these small steps you need to take. Okay, you need to understand, like, these negative thoughts and emotions will come. They are not in my control, but still I will stick to my values and goals. Still I will commit to them. I remember in ninth class, we had sports day, and I remember one of my friend Amit had taken part in a running race, and he started running and he fell down, but he stood up and he again ran and he came second. And that image is still in my mind because he committed to his goal. You may fall down, but you may get negative emotions, thoughts, you may get a lot of OCD thoughts, but you need to commit to getting better. And I promise you that it gets easier with time. Okay, so keep on trying, keep on doing things, and it will become easier with time. So I hope you understand acceptance and commitment therapy. I have made a lot of videos in Hindi, so if you understand Hindi, you can watch those videos. But my videos in English will keep on coming, and for people who do not know Hindi, can watch these videos and learn the important stuff. So I'll be making videos on ACT therapy. I have made the video on ACT therapy. I'll be making on ERP therapy, and then also I'll be making on my how I cured my OCD in English. So I hope you enjoyed this video and you understood something about OCD ACT therapy. And never give up, keep fighting.